So we're dispatched with a 4-year-old patient who's fallen off a ladder while cutting a tree. Walking onto the scene, the tree's on the floor, ladder's out of the way, there's no dogs or angry neighbours or anything. The patient's in a good position on the floor. Are you happy to continue?
Yes, I am.
Awesome, thank you. Cool. Hi sir, I'm Shezhana, I'm from AUT Ambulance. This is my co-worker Isabel.
Hi, nice to meet you.
What's your name?
Matt.
Matt? Hi Matt. I see you've got some bad bleeding there. Do you mind if I stop the bleeding?
Yes, please do.
Thank you. Isabel, could you please grab the history before the fall, short-term, long-term memory, allergies and any diabetes or anything like that?
Alrighty, Matt. So, what happened before the fall?
I was just up the ladder trimming some trees and I just fell backwards. I missed a run and just fell.
And were you feeling dizzy at all before then?
No, I wasn't.
Pause for a moment. I'm just going to put some saline on the dressing and also irrigate the wound. I'm then going to place the dressing on here and wrap it around with a crepe bandage using the twist technique for more pressure. Thank you.
So you weren't feeling dizzy?
No, I wasn't. I just lost my footing.
When was the last time you ate?
About an hour ago for lunch.
Okay, do you have a history of diabetes in your family?
No.
Are you on any medication at the moment?
No, I'm not.
And so you haven't felt faint or dizzy recently?
No, never in my life.
Okay, cool. So the patient, this seems to be a freak accident. There's no history of dizziness or diabetes in the family, and they ate an hour ago, so that their blood glucose levels should be pretty high.
Awesome, thank you. Patient is talking and responsive, so their airways are open and their breathing seems to be fine. Their GCS would be a 15. Could you please conduct a rapid trauma sweep just to check for any other bleeding anywhere else?
No problem. So I'm just going to run down your body to see if there's bleeding anywhere else. Is that alright?
That's okay.
Alright, so I'm going to elevate this wound now that I've put the first bandage on. So it looks to be a venous bleed, which is more kind of slowly oozing out of the wound. If it was an arterial, it would be pulsating out. Arterial are a lot more serious. You can get a few serious venous bleeds.
Ooh, that's a bit sore on my
There
ankle.
seems to be quite a swelling in the ankle and discoloration.
Thank you. We'll attend to that soon. Yeah, so venous bleed's not as severe, and you can try treat with direct pressure first. Arterial bleeds you'll probably want to get straight onto direct pressure and tourniquets usually. So what is your pain score at the moment, Matt?
Oh, it's 10.
10?
Yeah.
Okay. Can I please have your other hand? I'm just going to check your limb baselines. So what I'm looking for is the warmth, so your hands are quite warm. Little bit colder in this hand, mostly due to the blood loss. Colour in both hands. Checking capillary refill time. Cool, that's 2 seconds in this hand. 2 seconds in this hand. Can you tell me which finger I'm holding?
It's my pinky.
Pinky? And on this hand here, can you tell me which finger I'm holding?
It's my index finger.
Index finger. Can you wriggle this hand here? Perfect. Can you feel this?
Yeah.
Can you wriggle this hand here? Can you feel this?
Yeah.
Can you squeeze my hand? So, can you press on my hand? Perfect. Can you squeeze my hand here? Yep. And press on my hand here.
No bleeding anywhere else.
Thank you, Isabel. Limb baseline seem to be fine. Could you please watch this wound to see if bleeding comes with bandage, and then apply a second bandage?
No problem.
Thank you. Perfect. Alright, Matt. So I'm just going to pat you down and see if you've got any other pain anywhere else.
Okay.
Bleeding.
Thank you. Are you okay with me to touch you just all over just as check?
Yeah, it's all good.
Awesome, thank you. So I'm just going to start with feeling your head here. So I'm looking for bogginess here. There's no pain here?
No, none.
Coming onto your facial structures, no pain here?
No.
No pain down here?
Nope.
Any pain along your jaw?
No.
Is there any pain on the back of your neck?
Oh, right in the middle actually.
In the middle?
Yeah.
So about here?
Yeah.
Yep, okay. So you might have a spinal injury. So what I'm going to get you to do is hold your head as still as possible.
Okay.
We will probably put a collar on you when we get to it.
Okay.
Okay, so I just need you to not move your head. Thank you. All wrapped up. Awesome. Can you watch that for me, please? So we're just feeling here. No pain?
No pain.
Cool. So we're going along the collarbone here. No pain?
No pain.
Pain down your sternum?
No, it's fine.
Pain along your stomach?
No, it's good.
Cool. No pain here?
No pain.
So we're also looking for distension for any signs of bleeding into the stomach. No pain along your pelvis?
No, it's good.
None under your back here?
No, none.
Awesome. And so I know that this is your sore leg.
It is, yeah.
So can you tell me when the pain gets bad along here?
Yeah. Oh, yeah, I think if you went any further, it would be too painful.
Yeah, okay. So I'm just going to pull this down. Cool. So the ankle is very swollen, so we will get that root off very shortly. Moving on to here. No pain?
No pain.
Awesome. Okay.
It's starting to bleed through the second bandage.
Alright, so Matt, we're going to have to put a tourniquet on because your bleeding is uncontrolled. Now,
Is that going to hurt?
yes, tourniquets are very painful, and we're going to get you some painkillers as soon as we can. So what it's going to do is it's going to cut off all blood flow to the arm. It's necessary because otherwise the bleeding won't stop.
That sounds very painful.
Yes, so we will get you some painkillers as soon as we can. So typically you would put this on in as fast as you can, but because I'm explaining as I go, it's not going to be as fast. So tourniquet's on tight. You want it on a single bone portion of the limb, so not on a joint and not on like the radius or the tib fin. You want it 10 centimeters proximal to the wound. You want to tighten it until the pulse is gone. I'm not actually going to do it because Maddie is okay. And then you would, once that was tight and the pulse was gone, you would put the time over here. You'd check the time, so it's 1:26 a.m. So you would put that there, and I would then call for AUT1 to comms.
Copy.
I requested R50. I have a compromised limb and will need IV analgesia.
Copy. ETA 15 minutes.
Thank you. Alright, so the tourniquet's on. There's no pulse here. Isabel, could you please take some vitals? I'd like blood pressure, heart rate, respiration rate, pulse, like strength of pulse, auscultation of the lungs and temperature.
No problem.
Alright, so Isabel, could you please take this bandage off to make sure that the bleeding stopped? In real life we would just cut that. Also, can you recheck the limb base lines, please?
No problem.
Alright, Matt, what's your pain score at the moment?
Oh, it's a 10.
10?
It's worse than a 10.
Okay, would you like some painkillers?
Yes, please.
Yeah. Alright, so because you're lying down and you have a suspected spine injury, C-spine injury, I don't want to give you any tablets because that would require you to sit up and swallow.
Okay.
So we have IV analgesia on the way, so that the painkillers will come in a moment. What I'm going to give you is something called methoxyflurane. Have you heard of that before?
No, I haven't.
Have you heard of something called the green whistle?
Oh, yeah, I have heard of the green
Yeah.
reception.
The bleeding has stopped.
Thank you. And can you cover that for sterility? Just a note there that bandages would all be in sterile packaging, and this would also come out of sterile packaging, sealed, but it's a demo, so yeah. Right, so have you had this in the last 7 days?
I have not.
Do you have any kidney problems?
No, never.
No. Any known drug allergies?
No.
And do you have a family or personal history of malignant hypothermia?
No, I've never heard of that.
Okay, so usually if you haven't heard of it, it's unlikely that you have it.
Yeah.
And you seem able to obey commands, so I'm happy to give this. So first we're going to drug check this. So it is methoxyflurane. Because the patient is 40 years old, I will be giving 3 mils to start with, and then be moving to another 3 mils once that's finished.
Can you feel this?
I can feel that, yeah.
Calorie refill time is slowed down and temperature is getting colder.
Thank you. So precautions of a methoxyflurane is if they're over 75, which the patient isn't. If we were in a closed environment, it could put me and my offsider at risk of getting the drug as well. And if the patient had issues with toxemia or pregnancy or fetal distress, which because the patient's male, we don't need to worry about. So we've done the drug check. So I was doing the drug check. Methoxyflurane, so 3 mils to start with, another 3 once that's finished. The expiry date is the 10th, 2021. Could you please check that?
I agree with giving 3 mils, 10th, 21, and this is definitely methoxyflurane.
Thank you. So I'm just going to write that on my glove here. So the time at the moment is 1:31 a.m. Awesome. So to set this up, you would put the filter attached here, you would get the ampule, open the cap, pour it in while turning it around, and then give it a little bit of a shake, and then it's good to go. So Matt, what you do here is you can take this in your hand.
Okay.
So you're going to breathe in through this whistle, and it's really important you breathe back out through that whistle so it doesn't affect me and Isabel.
Okay.
If you want a stronger dose, you can cover your finger over this dot here.
Right, okay.
And you can inhale more deeply.
Yeah.
To get optimal results, if you breathe normally, because the drug is short lasting, if you breathe normally, you'll get a more regular dose rather than fluctuating.
Okay.
Yeah, cool. So you can suck away at that. I'm going to get these boots off and check the limb baselines of each foot. So, Matt, are you okay if we take your shoes off?
Yep, just don't be too sore on my sore foot. Please.
Yeah, we'll be really careful. You've got that green whistle there.
Yeah.
How are you going with the vitals? Did you get
Oh.
No, you don't have to do it now. Just where have you got to?
I haven't started.
That's okay. Yeah, we can get. That's not so important right now. We can get onto that. So what I will get you to do is just come around this side here.
Yep.
So if you could just hold the leg here and support the foot. So the idea is that you support on either side of the fracture.
Okay.
The possible fracture. Cool. And then I'm just going to slide the shoe off.
Okay, no problem.
Okay, are you ready, Matt?
Yeah.
We're going to go 3, 2, 1. Pulling the shoe off. Real quick. And I'm just going to get this sock off too. Awesome. Okay, so there is some swelling in this foot here. Feeling the colour in each foot. This one's a bit more hot, mostly due to the swelling. Both are pink. Can you feel this?
Yeah.
In both feet?
Yeah, I can.
Alright. Can you wiggle this foot's toes?
Would you like me to do vitals?
Yes, please, sorry.
No worries.
Can you wriggle this foot? Awesome. Can you feel which toe I'm touching?
That's my big toe.
Cool. And this one?
That's my second toe on the other foot.
Thank you. Just going to feel for a pedal pulse. Alright, so your strong and regular pedal pulse. And strong and regular pedal pulse here. Cool. I'm just going to do capillary refill time. Awesome. So capillary refill time is 3 seconds on this foot and 2 seconds on this foot. So they're all within a normal range. Capillary refill time you'd be looking at 3 seconds and under. Isabel, could you take? I'm just going to write down 134 for vitals that you're taking. Thank you. Cool. Alright. So now that foot, so the foot is well perfused. There is some swelling and a slight more warmth on this foot, but I'm happy to say that this limb is not compromised at this moment. So I'm going to attend to her C-spine, his C-spine first. So the reason I'm going to go for the C-spine first is because I feel like if we start moving the ankle, this Matt might want to move his neck out of pain. Alright, so starting with this, we want to measure it up. So the best way to do that is to come here with your fingers. So I've got about 5 finger distance between the neck and the base of the neck. So measuring 5 fingers here. I'd say Matt's about a regular. We'll try that first. Awesome. What's your vitals at the moment?
So currently we've got 37 for temperature. I couldn't hear any sounds in the lungs.
No crepitus, droga, or wheezing?
None of that, no. And the pupils were opening and closing.
Responsive?
Yeah.
Both equal response?
Mm-hmm.
Yeah, cool. So I'm just going to get you to pause for a moment and just come over here. Matt's neck.
No problem.
So Matt, we're just going to slip this collar on you,
Okay.
so it'll just help restrict the movement to your neck.
Okay.
So you're just holding at the base of the spine there and just, base of spine, that's not right, base of the skull, and just lifting really slightly while I slip this in. But just first I'm just going to double check that that was the right size. Yeah, that seems okay. Alright, so we're going to slip that in on your count.
Okay, on 3. 1, 2, 3.
So, thank you, you're doing well, Matt.
Do you want me to go back to vitals?
Yes, for the moment, please, thank you. Alright, how does that feel? Not too tight?
Not too tight.
It will be a little bit uncomfortable,
Yeah.
but if it becomes painful or the pain doesn't decrease or it feels too tight, please let me know.
Yeah, it feels funny, but not sore.
Okay, that's good. Yep, keep going.
Okay.
So, just with shock, I can't remember if I mentioned that because Matt has lost a lot of blood, he is at risk of hypovolemic shock. So the reason we're checking the vitals is to assess for that. If the patient was in hypovolemic shock, they would be tachycardic, they'd have a hypertension to start with, their rest rate would increase, they would be quite sweaty as well, and depending on the stage of shock, the limbs can become less perfused than the rest of the body. As the shock develops, if they start decompensating, the blood pressure at the very end will do a big drop, and that's when you know you're in big trouble, so that's why we're checking all the vitals now. So normal vital range, blood pressure should be between 90 to 140 systolic. Optimal is 120 over 80. Heart rate can be anywhere between about 60 to 100. Rest rates anywhere between 10 to 20 breaths, roughly, 10 being quite low. You might want to start looking at doing something about that. What else is there? Capillary refill time is under 3 seconds. Yeah, so that's all the vitals.
Blood pressure was 130 over 75.
Cool. So your blood pressure is in a normal range. Are you happy to help me splint the ankle? Thank you. So we should be getting backup very shortly to help us with the pain management. But until then, I want to, because this patient has lost a lot of blood, I want to get them into the ambulance where we can start managing their warmth to reduce hypothermia because of the blood loss. I have to take some duct tape because this is our last splint and it's completely falling apart, so I might need that. I want some actual tape to put it together. I want 3 triangular bandages, a towel. I think that's everything. Did you take temperature?
I did.
Thank you.
37 degrees.
So yeah, temperature should be about 37 to 38. Optimal range is 37.5. Anything slightly above 37.5, you want to start being a little bit more concerned about it. Alright, so to make the splint, we're actually running out of sellotape as well. But you can set that up. Can I get you to hold this, please, as well? Just having a bit of trouble with that. And then we run out of tape. Good stuff. What's your pain management now, Matt?
It's at about 5 now.
5? Okay, so the whistle's working?
It does, it's working well.
Awesome. And that collar's okay?
Yep, it's good.
Try not to use all that. Stuff on tape here. Bear with me. Thank you. Alright. So normally I'd use a lot more tape to stabilise it, but we're trying to reserve the amount that we've got here. Alright, so that's set up. I'm going to put, if you just put that flat up next to her foot there, just watching an injured foot there. So the size is good. You want it to fit distal to the fracture and proximal. You want to place a towel in there so that it's nice and comfortable. Cool. So I'm just going to move this. So what I'm going to do is lift the ankle, the leg like we did before. I'm going to slip 3 of these underneath and then slide this on. So you'll need to hold the leg for quite a while.
No problem.
Okay, are you sucking on that green whistle, Matt?
Yeah.
We're going to lift your leg again.
Okay, be gentle, please.
Yeah, we'll do our best. Okay, so 3, 2, 1.
Ow.
Thank you. Sucking on that whistle. Close that hole if you need it. Awesome. I'm just going to slide this in here. Just check it's all okay. Yeah, that's good. You can lower the lid down now. Thank you. Alright. Now with this splint, I decided on a box splint as opposed to a pillow splint because the box splint offers more stability. Matt, the splint should reduce the pain in your ankle.
Yeah.
If your pain is increased, let us know and we'll take it straight back off, okay?
Yeah, no, it feels a lot better now, actually.
Awesome, thank you. Cool, so what I'm going to do is reassess the... Actually, Isabel, do you mind reassessing both baselines on the feet here? Just to make sure that we haven't.
Alrighty, Matt, can you feel this?
Yeah.
What toe am I pinching?
That's my big toe. On my right foot.
Yep, under 2 seconds. Still quite warm, hot to the touch.
Yep.
Capillary refill is under 2 seconds, and there's still a bit of colour, although a bit of bruising and swelling down there. Okay, what toe am I pinching, Matt?
That's my second toe on my other foot.
Yep. Capillary refill taking a little bit longer, but I think that's just because we're outside. Can you feel that?
Yeah.
Alrighty. And a bit cooler to the touch than that one, but coloration's good, perfusion's good.
I'm happy with that. How's your pain now?
It's good, it's good.
What rating would you give it?
About a 5.
5? Cool, okay. Did you auscultate the lungs? You did?
Yes, I did.
Okay. So, another vital sign we could check would be blood glucose levels. Because we asked Matt if there was any dizziness before the fall, if there was a history of diabetes, I've decided that it's not suggested to do it. This was just a trip and fall, but yeah. And then he's just had a meal recently, so yeah, I'm happy with everything. We will, for extraction, we'll go get the scoop and put them in the ambulance until ICP arrive, and then we'll get them some painkillers and pump the heaters on. We'll leave the windows open in the ambulance for ventilation with the methoxyflurane though.
Cool.